international community in this outbreak has been health workers' infections. And I think that now, following reports and studies, we know that personal protective equipment, in particular medical masks, respirators, eye protection, gowns, gloves, do protect health workers if appropriately used. Also, we have learned and confirmed that appropriate hand hygiene protects healthcare workers. Conversely, also we have now evidence that shortages and inadequate practices, for instance, for hand hygiene, do put health workers at risk. And so I think that this is clearly a call to all those invested in this outbreak, in particular governments, but also the international community, to really continue to take care of personal protective equipment procurement in the context of access, equity among countries around the world. So this is a first message that is really key. The attention about this problem should not decrease. The second point we worked on from WHO with institutions, academic institutions, was to find out what is the best way to make masks, fabric masks for the population, the community, to protect them. And we achieved very interesting results in terms of knowing the type of materials, the number of layers to be used, the shape, the level of protection, or especially the level of filtration, allowing source control that is needed and that is available using specific materials. So all of this can be found indeed in WHO guidance that has been informed by this research. And we have a recent document on masks, in particular with focus on the general public. So these are some key messages that have emerged from research and from the discussions during this meeting.
I think I'd like to mention one other area, Fadela, and that's the area of genetic sequence data that we've got. I think this is probably the first time that we've seen all countries, almost all countries, willing to share the genetic sequence data of this virus in a public database. Through GISAID, through GenBank, we have over 60,000 sequences currently shared. And this has allowed scientists to do a couple of things. Most importantly, it's allowed epidemiological tracking of how, because there are different clades, because of the natural mutations that occur in the virus, they've been divided into different clades. And by looking at the proportion of these clades in different parts of the world at different times, you can actually try to put together a story of how this virus moved around the world and where it came from, where the outbreaks actually originated from. So that's quite useful to understand, and also to try and go back to see when the first few cases may have been introduced in a particular geographic area. But also it helps us to track the mutations itself. We know that there are certain parts of the virus which are more critical, like the spike protein and the receptor binding domain, that are also the targets for vaccines today. So if major mutations occurred in those domains, it might actually affect the development of vaccines. Similarly, there have been hypotheses by people from different countries saying a particular mutation, corresponds with a particular clinical profile, less severe, more severe disease. So it allows us to study. And so this kind of pooling of data, both clinical data as well as sequence data, and if the two could be combined, then it gives you a very powerful database to actually see if actual specific changes in the viral genome, mutations, actually have impact or not on clinical outcomes. And this is only possible when you have large data. It's not possible with a few tens or a few hundreds of cases. So that's, again, I think for the first time we've seen, and this is a very good model, I think, for future, for the world to think about future pandemics or diseases which can cause potentially epidemics or pandemics, and having a mechanism for global sharing of genetic sequence data gives you an opportunity. In fact, the genetic sequence data was made available by Chinese scientists on January the 11th. On January the 13th, I think we had the first diagnostic assay that was published. WHO, working with a lab in Germany, published the first, and that allowed countries to get their diagnostics up and running. And similarly, the first vaccine candidates were also being made in January based on the sequence data, because as you know now, sequence data allows you to do a lot of things. So the RNA and DNA vaccines were all being prepared in the lab within a matter of days of getting the sequence data. So it just shows how powerful this is and how essential this is, and why the world needs to think about some of these mechanisms and how to support mechanisms, platforms like GISAID, for example, to make it easy for scientists to share this. GISAID was set up for influenza data sharing, but very quickly they were able to expand to accommodate the SARS-CoV-2 virus. Thanks.
Thank you, Soumya. Now we will move to Nina Larsson from Agence France-Presse. Nina, can you hear us?
Yes, hi, can you hear me?
Yes, perfectly. Go ahead.
Okay. Thank you for taking my question. So, relating to what was just being said, I was also wondering if there was any discussion about the studies of wastewater that have shown indications that the virus may have been present in European countries, for instance.